Time now for this week's Health Matters with Lynn Szabo, PA at Large, in our community. How you doing today, Lynn?
I'm doing good. I'm here to talk about dental problems.
Not COVID?
Not COVID.
Wow.
I'm kind of COVID burnt out, but we could riff on that a little bit later.
Yeah, let's riff, shall we? Dental problems, and coincidentally, I was late to today's show because I had to take Lisa up to Brookings. She drove. I had to bring her home from Brookings. She had her tooth pulled, had to leave the county in order to do so because it was very, very difficult to get in any place around here.
Yeah, and it was hard because she was in a lot of pain.
Mm-hmm. A lot of pain, and I know we're not going to talk about COVID, but yeah, last weekend, I guess it was, in so much pain, I would have taken her to the emergency room for something, right? Toradol, something. But no, didn't dare because the hospital's just, chock full of COVID. So COVID did influence that as well. But
right.
So why is it so hard to get dental care in Delmar County?
Well, I found this paper. I asked that very question. I found this paper, which is creatively titled Research Brief Number 5, and it's kind of old, okay? It was published in January 2010 by Jessica Van Arsdale, who is a Humboldt County physician and Masters of Public Health. And it's online if anybody wants to find it. But they looked at Del Norte, Humboldt, Mendocino, and Trinity counties, and specifically looked at oral health. And they found an association between poor oral health and poor general health. But also in those counties, there's super problem with access to care.
Yeah.
Okay. So what they identified specifically as barriers were poverty, households with children, minority households, and the minority in question would be the Native population, younger adults, male gender, medical insurance, and need to leave the county to get services because it's hard for people. So,
and these were presented as what? As roadblocks to getting that access?
Right.
Okay.
Right.
So what, just having kids?
Yeah.
Or being a guy?
Well, having kids is that the kids get the priority on the resources and the parents don't.
Sure.
You know that.
Yep.
So in the getting a guy thing, or being a guy, I don't really know what that is except maybe just not wanting to deal with it.
You just rub dirt in it and go about your day kind
Denial,
of thing.
being tough, that kind of stuff. So
you make that sound like a bad thing.
It is sometimes.
The dirt tastes a little weird.
And so they made some suggestions about how to improve it. And these are all really straightforward and kind of dough. But anyway, reinstating adult Medi-Cal for dental care in a meaningful way. So people, oftentimes when I ask somebody who has dental problems in the exam room what their insurance is, they say I have Medi-Cal. They say they pay for it. But the problem is that they don't pay very much, and like 99% of the dentists don't accept it.
Yeah.
So that's not, it has to be real.
Now, is it because we do have the clinic here, right? The dental part of Open Door. They take partnership, don't they?
Right, and so at United Indian Health, they also take partnership, but
there are other downstream hurdles, though, right?
Yeah. But they also have a really limited thing, and they're mostly preventative. And from what I see at UHS, the focus is on kids.
Okay.
And as an adult, I never tried to get an appointment, or I never asked anybody if it was hard to get an appointment. But COVID, of course, kind of blew all that up too.
Yeah.
So mostly, it seems like as we kind of cope with COVID, that the focus is on preventative and kids. Mostly.
That makes sense. Yeah.
But that can be frustrating if you have an acute problem, and then you get into the circle of taking antibiotics, feeling better for a while, thinking that was the solution, kind of hoping. I think that's wishful thinking. And then having another acute problem, having the dentist tell you that they can't repair your tooth while there's an active infection, which is medical people will kind of roll their eyes at it, and maybe...
Is it just riskier? Is that why they don't want to take the chance to for further infection spreading and getting into your head and such?
Yeah, maybe, but I'm not a dentist, so I'm only kind of guessing here. But the idea in medicine is if you have an abscess, then draining it is the treatment.
If you have an abscess and draining and what?
Then drainage is the preferred treatment.
Okay, yeah, sure.
Because the antibiotics don't even reach the inside of the abscess where the infection is. So medical people don't understand why that doesn't apply to teeth. And it kind of sounds like that might be just a way to kick the can down the road and, manage press patients or something.
Really?
I wonder about that.
That makes me angry.
That makes me angry too, but I'm not a dentist.
Okay.
So that I think this uncovers a bigger problem, is that there's a big divide between medical care and dental care.
And why is that?
We kind of don't understand each other.
Yeah, and why are they, I mean, it's the same with vision too, right? So why are these parts of the human body sort of segregated off into these bureaucratic cubbies and such for us?
I don't know. Fractionated money, turf. I mean, there's probably a lot of reasons for that.
Yeah.
But I don't understand why somebody with a problem can't be dealt with acutely. But, maybe if there's a dentist out there that wants to share that information, I'm willing to believe that it could exist. So, but that's kind of, I'm going to address this later on.
I'm also, and I'm sorry, I don't mean to keep knocking you off track with where we're going here. I'm also thinking about whether or not, as far as the treatment and the antibiotics and the infection with dentistry, is there a difference as to the kind of insurance that they get as opposed to a physician? Is there something like on that side that would influence the care that you would?
Yeah, it might. It totally might.
Wow. Okay.
Or perhaps liability.
Yeah, same
totally
thing. Yeah, right.
liability.
Yeah, that's what I mean. Yeah, it's like how much of a risk are they willing to take, and are they willing to take a risk that might not seem to be a risk to a doctor because, medically, but then also they don't have to worry about it. Whereas for a dentist, it might be more of a risk, not just medically, but, financially and career-wise too.
What I would guess if I had to guess what the dental viewpoint is, if you pull a tooth and at a site of active infection, then you're dumping bacteria into the bloodstream, and that could be bad.
Right. And so is that,
But we do the same thing when we IND an abscess on somebody's butt.
It's exactly the same.
I have a strange skill set. I get it. But
we jump from, dental health to somebody's butt. And I'm like, wait a minute. Okay, all right. No, I'm back.
I don't know. Pus must drain.
Right.
There you go.
Got to get out. And so if you have an abscess and you've got something in our pocket that's built up and you're taking antibiotics, it's not the antibiotics that's affecting the abscess. If you don't drain it or do anything to it, it's just your body's. I mean, the antibiotics are going to address the underlying infection, but when it comes to the abscess, it's just your body reuptaking.
Yeah, they're not going to address it completely until the abscess is drained.
Sure.
That's the medical worldview. So so this paper looked at policy directions to lead to improvement. So one was reimbursing Dent-A-Cal in a more meaningful way, or partnership probably now since that paper was written. Increase service coverage and improve reimbursement. That's kind of the same thing. This is what I think they should do too, is open up access to Southern Oregon resources.
Yep.
Because the state boundary is kind of artificial, and we're trapped up here. We're trapped, by fires, slide, Pacific Ocean, and artificial boundary at the border.
You're right, and just distance from the state capital. Do you know? Is there anything analogously like coming south? If you live in Southern Oregon, is there anything that do they experience the same sort of sense of being cut off and remote from their state government in Oregon? I mean, if you're living in Brookings, do I think the same way about Portland as we think about Sacramento and Delmar?
Yeah, but they do. Otherwise, they wouldn't be talking about the state of Jefferson, whatever. One of those little racist guys.
I think Jackson was slightly worse.
Yeah,
I'd have to, I'd have to, if we were going to pick.
So I think they feel a little cut off.
Huh.
But there should also be more. We've already said this. More, I guess, collegial interface between the medical providers and dentists. And one thing that actually kind of happened for a while in the ER is that the PAs and the MDs there learned how to give lidocaine injections. And that can be tricky because there's a major nerve that innervates and relies, the whole function of the face is reliant on that nerve. And you could easily wing it, I think, and cause some damage.
Oh, wow.
But there were a couple of PAs who kind of learned how to do it correctly, and it really helped people as far as pain control. So that would be cool to do. Increase services to kids and focus on prevention. That's kind of happening. Increase the number of oral health care providers. And this is interesting. There should be dental PAs. In fact, they do exist in California. There's like, as far as I know, like 5 of them.
What do they call them? Dental PAs?
I don't know.
What's in that role then? I mean, that's just the role of the classic hygienist? Is that what
No,
that would
it's
be?
a little bit more. They can do some simple stuff.
Okay.
Like do fillings and extract teeth and stuff.
So you've got the tier of care that's like, you're cleaning and,
Right.
x-rays and things like that.
So preventive, interventional, and then kind of top of the pile for the most complex.
Mm-hmm.
So they do exist. Darla Dale is a dental hygienist in town who actually is working on the state level, and she's actually become one of these.
Wow, right here?
Yeah, these intermediary providers.
Yeah, they kind of bridge the
and
two
she
levels.
has her own practice in Humboldt County, but she's done a lot for Delmar in terms of especially kids and the developmentally disabled
Wow.
community to get, because they have to put them totally out a lot of the time,
Yeah.
and they just mostly they get all their teeth extracted. It's really sad.
Well, that certainly seems like something that could be a tremendous amount of help for communities like this.
Right.
And I mean, also a career path for people.
Totally.
So
Absolutely.
what prevents that from moving forward?
I don't know. I should text Darla and ask her. But there's like 5 of them, and I don't know that there's an established. I think that's probably schooling. I don't think there's an established accredited place where you could learn that. I mean, she's in the first 5 of these people, and so they're kind of like building the road as they're driving along. So. And she's always been a friend of Delmar, and I think she understands why that's so important. But she has her own practice now, which is kind of like, I can imagine there's political stuff between the dentists and this there were with physicians, nurse practitioners and PAs in the very beginning, and there still are between PAs and MPs. But, there's turf wars.
Yeah. You've talked about these things, and that's interesting to me because
Right.
she is practicing, and she is not a dentist.
She's not a dentist, and she's not practicing as a dentist.
Right.
She's whatever. I wish I knew the name of her intermediary position.
That's an interesting sort of thing. What's her name again?
Her name's Darla Dale.
Okay.
Yeah.
Okay.
She's been a friend of Delmar, kind of under our radar for a long time. She's done a lot of good things for the community.
Wow.
So there was an oral health advisory committee funded by Prop 56 money, and it's up on the Public Health Department website. And they are 5 years into it, and the website says they're still in the planning stage. And mostly they have like advertising videos for children's dental care and prevention. And I don't see that
No,
they've done
The
much.
5-year plan.
Yeah, well, yeah, and who knows? That could be a function of this board, or it could be a function of whoever's running a government website. As far as updating the information, right?
Totally, it could be. So if anybody out there knows what the Oral Health Advisory Committee at the Delmar Public Health Department does, that'd be cool to know.
I would just wonder, is this something that the healthcare district could or should be involved in? Or maybe they are.
Maybe they are. I've never seen them comment on it.
Or maybe they're doctors and they don't care.
I don't think that they don't care.
Really?
Because
Caldwell and Duncan are 2 pretty hard guys.
Yeah, whenever I think of heartless physicians, those are the 2 that I think of immediately.
What?
We're being ironical. They
Let
are
me
credits
get
to
my
the credits.
next point.
Okay, I'm sorry. Go ahead.
What can everybody do to make this better? Stop the judging.
Stop having teeth.
Stop the judging.
The judging of what?
The judging of people that have poor dental health, because it's automatically assumed to be a drug thing. To stop the judging because people can't get access to dental health.
Wait. How does this judgment get? I mean, it seems like
I'm calling out the medical establishment here.
So oh, okay. I thought you were like I'm walking down the street going,
no.
oh, okay, what are you, English?
It is it is a tragedy to lose a smile. And the funniest joke, sadly, that I ever heard about Delmar referred to women, toothless women up here.
Oh no.
And you're wincing. You get it. So I have seen people refuse to show me their mouths because they think I'm going to get all over them about meth use or something. But actually, there are a lot of causes for dental decay in this community.
And it's not just a standalone problem. It's indicative of all kinds of things in the body. Can influence all sorts of systems.
Right. It contributes to poor sugar control and diabetes. It can contribute to heart disease, and more than just endocarditis or bacterial growths on the heart valves. I mean,
yeah, there's like a connection, right? There's some sort of vagus nerve kind of, I'm not sure what it is, but something that there seems to be a correlation between dental health and so many other things in the body. So you're talking about the judgment of the healthcare community here as far as judging people with bad teeth?
I think a lot of travelers and people who are from out of the area who don't really understand the lack of resources here, especially in the ER level, but also in short timers in the community clinic, have been judgy on people.
Interesting.
And they weep in the exam room, and they're ashamed, and they don't need to own that, even if they're in a recovery program, because one of the 12 steps is making amends with your body. Yeah. And trying to fix all the stuff that happened to it while the person was using. And so we should welcome their attempts to reach out and not make them feel worse about their situation.
Yeah, definitely.
Yeah.
But that just seems to be a part of, like, I don't know, the Hippocratic Oath, or two, know the community that you're coming to work in.
Sure, and express your frustration not with the individual, but with the situation.
Yeah,
and then that should fire up action, right? I would think. So, but we're still waiting for
it's what I do every day, and I don't see things moving. So, I mean, but it also seems like just more directly, I mean, we need more dental healthcare professionals just in the community across the board, as with every healthcare professional or healthcare.
Yeah, totally. Other things the individual can do, because you guys always ask that. So practice preventative care. It really is important. That would improve health on every level. Stop smoking. Gargle. Gargle's important. And it can be salt water. It doesn't have to be something that you buy over the counter. And that's important actually in COVID too. That's widely used in South America. We don't really use it here, but it is helpful. Brush and floss, and maybe like toothbrushes ought to be more available, like condoms. You go into I haven't been in a men's bathroom for a while, but I know they have condoms in the women's bathroom. I know when Redwood Urgent Care marched in the 4th of July parade a couple of years ago, we threw out toothbrushes instead of candy. Oh, man. Those mothers, they were pushing each other out of the way to grab the toothbrushes.
Really? Because all I saw was the kids.
Huh. Yeah, the kids are like, what's this for?
The injuries coming into the ER afterwards. Right?
Yeah. It was serious, man. I think we got rid of like 500 toothbrushes.
So it's been sharpened.
Well, for a while, they had a group. They were mostly young people that were traveling, were going around, in particular like to bars and things like that, and handing out condoms and all of that. They could hand out toothbrushes. Why not?
It'd be cool.
I don't know, because it seems like until you figure out a way to get these people to get dental health care like more manageable in insurance level or Medicare or Medi-Cal rather, partnership I guess now, and flooded communities like ours with more healthcare, with more dental healthcare professionals, you can hand out all the toothbrushes and floss you want. You're not going to.
Now, I disagree, because I think there's a time lag there. So prevention is about being better in the future, and there's a lot of ways you can be better in the future.
Okay.
So, brushing, maybe your situation when the dentists finally show up is not as bad as it could have been. So.
Okay, all right, but allow me to retort.
Okay.
You have to start someplace, and if prevention is what you're being smart for the future, then what about GD now today?
Right. So it seems like prevention is a little bit covered, although I think toothbrushes are hard to access for some people in the community, and floss definitely. So you're right. Getting the proper providers in would be great. So. Darla, are you listening, Darla? Come on up.
More of you, Darla.
Darla would be
bring your
somebody
friends.
worth talking to, I think.
I think so. I mean, if there's only like 5 of Darla in the whole state, and we have one of them right here, that's really interesting.
Kind of right here.
It would be interesting if she was the same Darla from the Little Rascals.
No, she isn't.
She's not that.
Although she's a very animated woman, she definitely would talk
I think
to
that
you guys.
Darla ended up being an ambassador.
I think you're right.
No, that was the little
Be
show.
antibiotic savvy. Don't accept the same antibiotics that they gave you before that didn't work. Okay.
So this is something that has been an issue because not only, all right, so Lisa's been on antibiotics for way too long now trying to get this tooth out, right? And she's also a redhead and has weird stuff with her body, and pain relief doesn't act right with her, and antibiotics take like longer to kick in with her.
Right.
And they were, and I'm trying to get, this was another thing, and we've often, your name comes up when we talk about this stuff because we're talking about trying to get her at the height of all of this. She had a tooth, needed to come out, infected, antibiotics, COVID shuts everything down, infection returns, more antibiotics. It's been going on like that for a good 2-3 months.
Right, they're kicking the can down the road.
And we can't, what we needed to get was, and this was how your name came up in the discussions, we talk about being our own best advocates. And that is getting somebody in the room that will sit and listen finally to this whole story instead of telling this part to this person, this part to this person over here, this part over, somebody who would understand, because she was trying to get something like a Z-Pack or something that was more than just amoxicillin, because the amoxicillin was just taking forever to kick in. And finally, it started working 6th or 7th day into it.
Okay.
It's that she started getting actual relief from it, but it just seemed like that was kind of like lightweight antibiotics, and she needed something more. Is there anything somebody in that situation can say or do or appeal to, to get that next level of care that they feel they need?
In that situation, the first thing I would have said is, this is the 4th course I've had of this particular antibiotics at this dose. So I think the patient, those words can come out of the patient's mouth. Second, let go of the Zithromax. It's not the right drug for this.
Okay, that was an example. I wasn't
ask
pulling
for
that.
it,
Yeah.
And if you really want to get a provider's attention, what would get my attention is, have you considered anaerobic coverage? Now, I understand that's a really technical sentence, okay, or question, but, write it down, and just say it, because I don't know anything about Lisa's care. I'm not involved in it, but she had an anaerobic, my guess is an anaerobic organism that was causing it, and
Okay.
amoxicillin wouldn't treat that. We use other drugs for that. And actually now because there's so much resistance from the habitual use of amoxicillin when it's not, super appropriate all the time, especially for somebody who has long-term problems, is that they're going to 2 antibiotics. And so if I use just plain amoxicillin, I also use metronidazole, also called Flagyl. I know this is getting technical.
No. This is
Your
the
eyes
kind
are-
of stuff. No, I wouldn't.
Yeah, your eyes are glazing over.
It's just the time of day. Don't take it personally.
Okay, but the most, what gets me there in my head is anaerobe. And so the way the patient can kind of like ring that little bell, I've been going on a long time. I've been using this antibiotic. It hasn't really been helping. I'm wondering if an antibiotic change is appropriate. And if you really want to get somebody's attention, you speak in our language, anaerobe. So anaerobe is a type of bacteria that doesn't use oxygen to grow. Okay. And, if you said that and I was in the exam room, I would go, what? So, and then that takes this whole antibiotic choice in a completely different direction. So amoxicillin plus metronidazole, Augmentin is oftentimes recommended now, and everybody's friend clindamycin. So I don't think I'd use amoxicillin, more than twice.
Okay. That may be what they go, and again, this was all the wonders of modern healthcare. This was all a conversation with the receptionist or whoever answered the phone.
Right.
And
Who, when I put my daughter for a dental abscess where her face was swollen, I put her on amoxicillin and metronidazole, and the receptionist said, wow, those antibiotics are way too heavy. You shouldn't be on there. She said, well, my mom graduated from Duke PA program. Where did you graduate from? And then,
smack.
yeah, because my kids,
Whoa, send that receptionist to the
sassy
burn
girl.
ward.
My kids defend their mommy.
So at Open Door, they have these folks that work there. I know them as promotors, right? And they seem to be sort of people that can help folks get guided to health care and or insurance, things like that, right?
Yeah.
do they only have those on the health side, or do they have those on the dental side?
Yeah,
or?
do they work for the whole building?
Yeah, right. I don't know.
They work for the whole building.
Oh, okay.
And they're actually a good third party if you have a complaint with somebody.
Mm-hmm.
I mean, I've known a couple of people who worked in those
And they
positions.
there's also fluency in Spanish too there,
Right.
which is key. So, yeah, I think they'd be good advocates. I think it's appropriate to question the type of antibiotic. I also think it's appropriate to question the time that you can get somebody in and see if the provider will advocate for you. So if we're seeing you like on an urgent care basis, let's say I've never seen you before, or last time I saw you was for your athlete's foot 6 months ago, I'm not really clued into the whole story.
Yeah.
Like Lisa's story had a lot of chapters. I'm only focused on this one chapter and getting on to the next patient.
Mm-hmm.
So if you can say things like, it seems like we're just banging our head against the wall with this amoxicillin. Have you considered that adding a second antibiotic? If you don't want to say anaerobe, these are things that you can say, and a respectful provider should make them like raise an eyebrow and look into it further.
Okay.
Right.
Okay. Again, it comes down to, being your own best advocate.
Right. And we used to be able to call the dentist and say, hey, really, is there something we can do for this person? And now they won't even take our calls either.
Wow.
So it's everything in medicine is fractionated, and this is not good in the long run.
Mm-hmm. Mm-hmm.
So, and then also the most important thing is we need to reassess fluoride in this community.
Yes. Yes, we do.
Yes, we do.
Yes, we do. We've
Yes,
talked
we
about
do.
this before. Yes, we do.
I know. And I think we should keep talking about it.
Maybe we can
because-
bring that up tomorrow with Eric Weir when he's in.
I was going
What-
to say, I'm so sorry because we are at 11:30.
Yes.
But that seems like a great episode to crack open because I saw complaints about fluoride recently.
So I just would.
Yeah.
What would the reassessment of fluoride entail?
adding it back into the water supply.
Oh, because they took it out.
They took it out at the behest, and it was Donna Westfall's were doing it.
Yes,
Yeah.
But she had friends
course.
out of the county, didn't she?
I think she actually had a lot of coaching and yeah.
So
yeah.
people out of the county telling Delmar what to do?
Well,
I don't
yeah,
think
yeah,
they
but I'm
like
not
that.
comfortable applying. I'm not comfortable appealing to that kind of
The
like
John Birch-
homegrown xenophobe sort of feel.
Okay.
It's more about just that being a wrong-headed thing to pursue.
The John
in your-
Birch Society was doing that 50 years
yeah,
ago,
right. No,
you know?
yeah.
Well, you ought to see what a 5-year-old kid looks like with a swollen face and in pain.
No,
What
no,
would be-
I have complete dentures. I know what not taking care of your teeth ends up
Right.
like. The lucky part, of course, is that I had enough insurance to actually be able to
Right.
come out of it with something.
Okay, we'll need to discuss this more. Let's do, because there's a plan of attack, and there's something that should be done, and we need to have like numbers, and we need to have trend sense, because we're pushing 10 years without fluoride now,
Really? Wow.
something like that. Yeah.
Wow. Maybe that's why we're seeing it so much.
Interesting. Yeah. Okay. Yeah, and it's just a good idea to go and undo some of that Donna Westfall stupidity in the community. I'm good with that too.
Yeah.
Lynn Szabo, thank you so very much. Let me know when we can do the fluoride thing.
Okay.
Any idea what you want to look into for next week? See what happens.
Well, there's a variant of interest, which might be turning into a variant of concern called the Mu
The
variant. But also,
Can't wait for Theta.
September 20th. Supposedly, people are starting to get boosters. Yet that looks like it's not going to happen as easily as we'd hoped.
Really?
Yeah, maybe
What-
that's the more timely question.
Talk about boosters and how they might not happen.
Yeah, Team Pfizer's ahead of Team Moderna on that. But Moderna seems like they're problematic. Anyway,
All right. That's Health Matters. Lynn Szabo, PA in Delmar County and farther afield. Thank you so very much.
yeah. And there's nothing wrong with Moderna. It's just record keeping.
Okay, no, I didn't feel. Yeah, I didn't
Yeah,
feel.
okay.
I thought it sounded like because
Yeah.
they did all right so far.
I'm
so.
glad to know that.
All right. Lynn Szabo and Health Matters. We'll catch you again this next week.
Okay.
All right. Thank you much.
Of all the radio stations that tell you they love you, we mean it. KFUG.